Hey, this is Steve Shaw, physical therapist, and we're going to talk to you a little bit about some things that can happen to your neck that can generate headaches that we're seeing more of with COVID and what everybody's doing, working from home, where they might have a workstation with not great body mechanics set up for it, and what that can do to cause headaches. So what'll happen is the average head weighs as much as a bowling ball. So if you're in a position like this, with your good back support, sitting up good and tall, that bowling ball is on the top of your shoulders, sort of like a lollipop on a stick, and it's balanced, and it doesn't take a lot of effort to hold that bowling ball up. But if you're in a squinched position like this, because you're in a working like this, or you're on your phone like this, the head is in front of the shoulders, and all that weight has to be held up by those muscles, because if the muscles in your neck relax, what happens? Your head's in your lap, so it's constantly in this position. Let me show you what that does to the muscles in your neck. They're right at the base of the head, and they control the head. And you can see when I'm upright, you can see how far apart the ends are, but when my head goes forward, you can see how tight those muscles are. They're all contracted, and that causes problems with those muscles tightening up, and it can generate headaches up into your head. So those little muscles at the base of your neck aren't happy being contracted all day long. Just like if you walked around all day long with your arm like this, your bicep wouldn't be very happy. So they can get tight and they can get sensitive. And what you may find is if you poke the muscle and look for a tight spot and really dig down hard, you may have a pain that goes from there up into this area and maybe even behind your eye. That's a common pathway for headaches from the neck, which we call cervicogenic headaches. Now there's a few things you can do about it, and we're going to go over that. There's several things you can do about this, but I'm going to show you a technique that was developed by Brian Mulligan from New Zealand. And what it is, it's the way where you can stretch those tiny muscles at the base of your neck. So you need a pillowcase or a towel about that long, and you just hold the edges. It goes over your neck right at the base of your skull. And one part comes across, don't let it bind up over your shoulders. One comes across right under your nose, and the other comes down here. So what you're going to do is you take that, you're going to run it right under your ear, right under your nose, and then you're going to turn it. As you turn, you're going to push with this. You're going to anchor here, and you're going to push with this to pull your neck around further. So you turn your head, and then you're going to pull at the end with your hand. And it's going to be about a 6 count, 1, 2, 3, 4, 5, 6. So 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 6. You do about 6 of those, and you should feel it stretching right at the base of your neck and relieving some of that tension. If it hurts, don't do it. You're not doing it right. And we teach a lot of people this to take care of their own headaches. So if you need to come by and get some help with headache pain, feel free to come give us a call. And let me emphasize, this is a somewhat semi-complicated technique, and your hands need to be in the right place, and you need to give the right pressure. If it bothers you at all, don't do it. You may just want to try 3 easy ones, and if it doesn't feel better, leave it at that. If you have suboccipital, is what we call those headache problems coming over to the front, there's something we can help you with, let us know. Good luck.